If one or both of your knees always seems to hurt at the front or on the inside, you may have a remarkably common issue called dynamic knee valgus. So in this video, I explain what that is and how to correct it so that you can be finally free of your knee pain. If your knee turns in too much, even subtly when you walk, run or do sports, it can strain inner knee tendons and ligaments, make the kneecap rub along its groove causing pain underneath your kneecap, cause tendon pain above or below your kneecap, or damage your meniscus or even your ACL ligament. Two main things cause dynamic knee valgus, both of them very common and correctable. Flat or pronated feet, where your foot arch collapses, and weak external rotators of the hip, the outer glute muscles. So let's have a look at how to correct those. If you stand with bare feet and someone looks at you from behind, and instead of looking like this, your feet and ankles look like this, then foot pronation is the most likely culprit. Now there's three ways that you can correct foot pronation. Orthotics can help to lift a foot arch that tends to collapse. Pronation support footwear, which has a stiffer sole that resists twisting, can help. And strengthening the muscles that help to hold the foot arch up can help too. Two of the best exercises are the short foot exercise and a modified calf raise. So let's start with the short foot one. Sitting down with socks off, squeeze the muscles under your foot to scrunch up your foot and increase the arch of your foot. The tendency will to be scrunch up your toes as well, but aim to keep the ball of your foot down and your toes straight. This will take a bit of practice. If you were to compare it to a hand motion, it would look like this motion rather than this motion. This lifts and supports the arch of the foot using the small muscles of the foot. Hold the lift for 5 seconds and repeat 10 times daily. After a few days, you can progress to doing it standing. Next, we strengthen longer muscles that begin in the calf that support the foot arch. Standing, put a folded cloth between the heels and bring the heels together and up in a scooping motion to lift the cloth. Hold at the top for 5 seconds and repeat until light fatigue, which can be anywhere between 5 and 20 times depending on your fitness, daily. I'll leave a link to a video with more details about correcting foot pronation. The other common cause of dynamic knee valgus is weakness of the outer gluteal muscles. These muscles stabilize the pelvis when we're standing on one leg, but they also externally rotate the hip, so if they do get weak, your knee can turn in too far. If you get muscle aches in the outer pelvis at the back, this is a good sign that this is your issue. Lateral leg raises and clam exercises are often recommended to strengthen these muscles, but in practice, I find that closed chain exercises with your foot on the floor and your body weight on it give much better results. Just one exercise here can be enough. To do this, balance on the leg of your sore knee, then firstly turn away from the leg that you're standing on and hold that for 5 seconds to strengthen the external hip rotators. Then slowly lift the opposite side of your pelvis up and down, and slowly hinge forward over a slightly bent knee, making sure that your knee doesn't turn in as you bend. Repeat that slowly until light fatigue, but no more, daily. Just make sure you keep your knee straight as you rotate away from that side and move slowly so as not to strain the knee. Make sure that you're tilting your pelvis up and not just lifting your outer leg as you tilt to the side. And keep the knee of the leg that you're standing on straight over your foot, not bent to the inside as you hinge forward. Now, anterior pelvic tilt internally rotates the hips slightly, which can add a bit to knee valgus, so I'll leave a link below to a video about how to correct anterior pelvic tilt too.